transitioned some of our tech work. We did some other interviews, but we're going back to regular briefings starting on Mondays and Thursdays beginning next week. And so we'll definitely have our briefing that we're doing now. We'll do some also as needed, but there will be a regular Monday and Thursday briefing at 3 p.m. Starting next week. As of today, we have 5,849 residents that have tested positive for COVID. That's an increase of over 230 individuals since just yesterday. We have 98 people that are hospitalized in our hospitals. Of course, the good news is we've had over 4,200 that have recovered, and we have lost 151 residents to COVID-19. That 151 is more than we lose over many years just to gun violence alone, and we've lost them in just a few months. So that shows you the seriousness of the virus and the pandemic that we have in front of us and in our future. I want to start by, of course, thanking Kelly Colopy, our health director, who will be on to talk especially about testing in a few minutes, and of course, Paola, who always does a great job of our ASL translation, and Alice from the health department, who will be doing our Spanish translation at the end once we've answered some questions. So I want to start on a personal note, and I think most folks know this already, but the COVID-19 crisis, as we know, is impacting our country, has impacted our city greatly and so many families, and is also currently impacting mine. So both my mom and my stepdad have recently tested positive for COVID-19, and they're also both currently hospitalized, and both are on ventilators. So my mom, and those that know her, know that she has been a healthcare worker almost her whole life. She's worked at the same clinic, providing amazing care to people that need it most of her career. And more than anyone in our family, she really understands how important taking care of one another is during this moment. She has been incredibly careful and understands the seriousness of COVID-19 and this health crisis. Thankfully, both are in stable condition, but they are both on ventilators. And so they are in serious condition and in the ICU. We hope, of course, for and expect, and we're putting all our positive energy into a full recovery for both. I just want to say that both of them are receiving just amazing care by doctors and nurses, and these individuals are above and beyond doing heroic work in our hospitals, and I just want to thank them so much on behalf of my brother, of myself, of my family, for all the work that they're doing. Wanted to note that my husband Matt and I have not interacted directly with my mother or my stepfather in many weeks, so we weren't exposed to them directly. And obviously limiting family interactions has been hard, but I know we've all been doing it. It's the right thing to do as well. We also both tested negative recently, of course, as a precaution. And I want to just let folks know that seeing, of course, our family in the hospital struggling is hard. And I don't want anyone in our city to have to go through the same experience. Being at this moment where we're taking this seriously, we have to remind ourselves that COVID-19 is not a hoax. It is serious. It is causing individuals to lose their lives every single day in our city. And I hope we can continue to move forward in a way that thinks about the most vulnerable first. As my mother's son and as your mayor, I promise to continue to lead us through this pandemic with resolve, compassion, and kindness to each other. I want to keep all of our families healthy, and I want to keep our city moving forward, and we will continue to work hard every single day. I also now want to transition to some of the news as made by the governor just yesterday. So the governor, of course, announced various additional statewide closures, and I want to walk us through those in a bit. The first thing I want to note, and this is something that's important, your city, our city, the city of Long Beach, has had the slowest and most cautious reopening schedule of any city in the region. In fact, of any city in most of Southern California. But even with those closures and the pace that we took, we see our positivity cases going up, and we see hospitalizations going up. So what has the governor done statewide in California? He first closed, of course, many types of activities that were already closed in Long Beach. And this include dining in at restaurants, wineries and tasting rooms, family entertainment centers, zoos and museums. We, of course, had closed those weeks ago, but the state has now closed those for every single county across California. They've also made some additional closures. He also, in about 30 counties across the state, and essentially any county that has urban centers where folks are living together, he's made additional closures. And these closures, by the way, not just impact Long Beach, LA County, they impact Orange County and Riverside and San Diego and all the counties and cities around our community. So these been difficult decisions, but they have also additionally closed indoor activities at the following locations: gyms and fitness centers. We know that office places that are non-essential are encouraging that we go to telework, hair salons and barbershops and personal services, including nail salons, esthetician work, cosmetology services, tattoo parlors, and other types of services. Now, if any of these types of businesses are able to move outdoors, and in some cases you can do so, we want to work with small business owners to help their businesses thrive in an outdoors setting. We've done the same with our restaurants. In just a few short weeks, we have installed and opened more than 80 parklets across the city, providing additional outdoor dining for our restaurants. We've also opened up and worked to expand parking lots for additional restaurants that are now opening up their parking lots to guests, and you're seeing that all across the city. And places like the Promenade and other locations, we're expanding as well restaurant space. And so if you are a small business, a small restaurant, we continue to work with you. We have fulfilled almost every single request for a parklet. We've just got a handful of them left, and we continue to work through those. And so if you are a business owner that has been affected in this last closure, we know it's so hard. We know it's incredibly hurtful to your own family and your workers. We do want to work with you and encourage you to reach out to us at the city. Folks can call our business line, which is 570, the number 4biz. They can email us at the number 4, which is 4biz@longbeach.gov. Or they can also go to the longbeach.gov public works page, and they can actually apply for an open streets program application really quick right on the website, and we'll get right back to you to make sure we can help you out in your business. These closures we know are difficult, but we want to also let folks understand that COVID-19 in California continues to be serious. I want to now review some health data with everyone, and once we get through the health data, I'm going to also discuss Long Beach Unified School District and then turn it over to Kelly Colopy for testing. So we've been sharing health data all the way throughout this pandemic. We'd also like to provide you an update of where we are today. I want to show you some slides, and we've shown you these slides before. This first slide indicates the COVID-19 cases by episode date. And as you can see, this time just last week, we were at 4,600 cases. Today, our case count for the city is over 5,800 positive cases. That is an increase, and certainly an increase that we should be concerned about in just a week. More people are transmitting COVID-19 to each other in the community, and that indicates community spread. To date, we have conducted nearly 94,000 tests. Those tests, majority of them, of course, have been free to anyone that needs one, and we're going to talk about testing in just a minute. We also know that because lag times in reporting, we know that these numbers will change and will slightly adjust over time. Now I want to show you this next graph, which are cases by population. Long Beach is represented by the light blue line on the slide you see, and we continue to be above the state's case race, of course, by 100,000, but trend still lower than both the city of Los Angeles and LA County as it relates to cases per 100,000. I want to show you this next image also, which is deaths per 100,000. Long Beach is represented by the light blue line in the slide, and you've seen this slide before. Our COVID-19 deaths per 100,000 is below LA County, but also still above the state level. We continue to have approximately 2 to 3 deaths reported to us every single day. This is serious. Every single one of these individuals that loses their life is someone's mother, someone's father, a grandparent, a son or a daughter. And so we mourn and think about every single family. These 151 individuals that have died have our sympathies and our condolences, as well as their families. And now I want to show you a trend that continues to concern us, and it has since day one, and that's hospitalizations. Hospitalizations are reported daily, but over time, these numbers change, of course, as we gather more accurate information from the hospitals. As you can see, our hospitalization rate has begun to steadily increase in the last couple of weeks. And if you look at the 14-day average, because we know we add hospitalization numbers after we get them, we've had an average of about 101 hospitalizations for the past 2 weeks, and an average of about 91 for the past 28 days, or almost a month. So you can see there has been an increase if you look at the average. Now, currently, about almost 40% of our hospitalizations are associated with long-term care facilities and residents that live there. But we are also monitoring those trends closely and are seeing now more individuals of every age and of all backgrounds. I want to now show you our Long Beach area hospital data. This is data from our 5 hospitals that we monitor here in Long Beach and our partner hospitals. Our hospital bed usage continues to remain stable around 60%. But I want to just note that this number is gathered from a state website of which the hospitals report to. And so the hospitals aren't giving us this information directly. They report it to the state, and then we get it from the state. There is lag time in this number, and everything I'm hearing out of our hospitals, they are concerned about this issue. We also have surge bed capacity available, convention center beds, and ventilator use. I'm going to turn this over now to Kelly Colopy. I'll actually go back to the schools once Kelly has concluded, just to go over testing and how we're doing with testing.
Good afternoon, everybody, and thank you, Mayor. First, I want to start off by reviewing our stability indicators. These are the indicators that the state tracks on when it determines who is on the monitoring list. It is the monitoring list that guides whether we are required to close down businesses that other counties and jurisdictions do not have to close if they are not on the monitoring list. So at this time, there are 6 different items on the monitoring list, and we do not meet the stability requirements for 2 of those. So the state requires a positivity rate of under 8% over 7 days. Our positivity is 15.1%. Our highest was 15.2% a couple days ago, and that's the highest that we have seen since we started tracking positivity rates. This is up from 6.3% when we began the process of opening. The state also requires a case rate of less than 100 per 100,000 residents. We are currently at 320 cases per 100,000. This is 3 times the number as the state focuses on. We are still healthy in terms of our access to ICU beds, regular hospital beds, and ventilators. Since we last shared with you, more people under the age of 30 are continuing to test positive. 1/3 of those cases are now under the age of 30, compared to less than 15% early on. In fact, 21.5% of those cases are under 30, are in the age of 20 to 29. This age group has the highest percentage of all groups in the city. We're also seeing an increase for those in the ages of 40 to 59. When you look at the charts, you really see that the ages 40 to 59 also increasing. We are also seeing more younger people hospitalized in our community. So hospitalizations are the highest for ages 40 to 59 for those who are not in long-term care facilities. This is higher than any other group. We are also seeing increases in hospitalizations for those who are ages 20 to 39. 56% of all of our hospitalizations are now coming from our community members. For some time, those numbers were over half from our long-term care facilities. They are now coming from community, and this is our highest percentage that we have seen from our community members. And this is due to the increase in hospitalizations for our younger population. As the mayor said, people are out and about in our city. We're getting together with their friends and extended families, and we feel like it's safe to be with others that we might refer to as our COVID circle, the people that we trust that are not going to bring us COVID. There really is no such thing. Your only COVID circle are the people that you live with, the people that live in your household, where everybody is doing their very best to protect themselves and to protect you when they come home. The more people are out, the more likely they will to bring it back to you, given the level of community spread. So please be vigilant in following the rules. So I want to announce some testing changes. Just in the last week alone, we've administered over 12,300 tests in the city of Long Beach. It was just a tremendous effort. We cannot thank our city staff and volunteers enough for all of their hard work, long days, and it's been hot out there too, and they've been able to serve everybody who has come up within the last week. We want to make sure you're aware that our city-run testing sites will all have new hours starting tomorrow, July 15th. So the Long Beach City College Pacific Coast campus will be weekdays from 10 a.m. to 1 p.m. The Long Beach City College Vet Stadium will be weekdays 10 a.m. to 1 p.m. and 3 p.m. to 5 p.m. So there'll be 2 shifts there. Cabrillo High School will be on weekends only from 10 a.m. to 1 p.m. and 3 to 5 p.m. So Cabrillo will be the weekend location, and they'll have full appointments in that location. Due to increased demand for testing, appointments are required for all testing sites and can be made online or by calling the 562-570 info line, 562-570-4636. Also, we are focusing our testing efforts primarily on those who live in Long Beach, Signal Hill, Lakewood, Paramount, and Compton. People from other cities will be directed to county facility testing or other private testing options as they become available. So if you're signing up for a test in Long Beach, you must be from Long Beach or one of those other cities. Appointment time slots will be made available no more than 3 days in advance. So there will be new appointments coming on every day for the upcoming 3 days. Each day you'll have access to over 1,000 new appointments will become available on the test. And then we have capacity to serve about 1,400 each weekday, including the Jordan Plus site and the rack. We actually have right now open appointments at Veterans Stadium. So if people need a test, you can sign up. And we'll have over 1,000 appointments becoming available at Cabrillo High School starting tomorrow for Saturday. Walk-up appointments will not be available anymore at any of our testing sites with the exception of our Rapid Assessment Clinic, otherwise known as the RAC, which is at Long Beach City College at the Pacific Coast campus, and it's for symptomatic patients only. So people seeking tests will be assessed for symptoms, and if they are assessed and they have symptoms, then they will be able to be tested through the RAC. The RAC is open from 10 a.m. to 1 p.m. on weekdays, and it is walk-in only, it's not drive-up. In addition, our state-run testing site at Jordan Plus in North Long Beach remains open on weekdays from 7 a.m. to 7 p.m. I also want to let you know that we've implemented a new technology to further support our investigation and contact tracing efforts. It's an electronic case interview. Each Long Beach resident who is tested at one of our drive-through sites and is notified that they are positive will be asked to complete an online form to list some demographic information and the people that they were in contact with while they were infectious. This will allow us to follow up with them to ensure that they are safe, that they can be, and this will allow us to follow up with their contacts to ensure that they are safe and that they can get tested when needed. Given the increase in cases, this new technology will allow us to gather the essential information more easily and connect those who need support. Thank you in advance. If you ever test positive and you get this survey, please complete it and get it back as soon as possible so that we can work with you to make sure that your people that you have been around can be safe. I also, before I wrap up, I want to take a few moments to remind you that our best defenses for fighting this pandemic. I know the new closures are very disappointing to patrons, and they're devastating for our local business owners. My heart goes out to all the businesses who are struggling through this pandemic. Before we can even think about opening, though, we must slow the spread of COVID-19, and we must all do our part and use our tools to fight the virus. I hear often individuals saying, this is my own right, and why do I have to do this? And I think it's very important for those who feel that their personal choice outweighs the health of those around you to please consider the impacts on your friends, on your local businesses, and our overall economy and our community. The increasing cases, the hospitalizations, the closures of business, they continue to impact everybody around us, and it's so important that we all do what we're supposed to do and follow the protocols, which include wearing a face covering whenever you are out in public or around anybody, always practicing physical distancing unless you're within the member of your own household, regularly wash or sanitize your hands, and if you feel even the slightest bit sick, please stay home. We have to follow the safer at home order if we want to lower our positivity rate and flatten the curve. But a flat curve doesn't stay flat if you don't remain committed to all of the guidelines and prevention measures. The reality is that flattening the curve is an active process. Everyone must actively choose to take this into account while making decisions every single day for all of us, for everybody that you are around. And we talk a lot about person-to-person spread, and it's important to understand that one person can infect more than one other person. So you hear this thing about the R0, right, the transmission rate. So the R0 of 1 is one person infects one more person, and that sort of like maintains the same level. Right now we are an R0 of 1.12, which means an exponential increase in cases. And our goal is to bring that below 1. That is the only way that we can start to reduce. And a person infected with the virus can be contagious for as early as 2 days before they begin showing symptoms. In addition, some people are asymptomatic, meaning they never develop symptoms and they feel just fine. It means that even if you do feel just fine, that you can still inadvertently spread the virus to all those who are around you, and you don't even know it, further emphasizing the need for everyone to practice physical distancing and wearing a face covering. This is why we have 2 health orders in place for residents to follow if they test positive for COVID-19, are presumed positive, or have been exposed. So our self-isolation order requires the individuals who have tested positive or are presumed positive to self-isolate for at least 10 days after symptoms first appear, and at least 3 of those days have to be fever-free without use of medication, whichever is later. If you're required to isolate, you may not leave your house, and you cannot enter any other public or private place during your isolation time except to receive necessary medical care. Additionally, individuals in self-isolation are required to notify any close contacts they had up to 48 hours before their symptoms started or while they were symptomatic to let them know that they have a potential exposure and they may need to self-quarantine. Our self-quarantine orders require anyone who knows they've been in close contact with a person who is likely to be COVID-19. They must quarantine in a residence for 14 days, counting back to 48 hours before the person you were exposed to had symptoms. Because then you have a high risk of developing and spreading COVID-19. You may not leave. If you are quarantining, you also may not leave your place of quarantine to enter any public or private place except for during the duration of your quarantine period, except to receive necessary medical care. One last clarification that I want to make before closing is about the protests. With the updated order, we've been getting a lot of questions about the need. Do we need to have a permit to hold protests? While there are certain city-issued permits, they're not required for political protests. Political protests are always protected. Indoor protests, however, are prohibited under this new order. We know these past few months have been very difficult. We know the rules keep changing of where you go and what you can do, and it's incredibly frustrating. We know you miss your family and friends. We are truly in this together, and we have the power to change the course again and to stop the spread. Please frame your choices every day focused on your safety, your family's safety, your friends' safety, and your community's safety. We can do it. Thank you.
All right, thank you, Kelly. Today we're going to first start with some questions from social media. Both of them are for you.
Okay.
There's a lot of questions about long-term care facilities. Do long-term care facilities have all the PPE and staff they need? And also, what is being done to help prevent COVID-19 from coming in?
Yeah, so long-term care facilities have very tight requirements about who is allowed in, and then they do temperature taking and a lot of screening each day when it comes to staff or anyone else who is allowed in. In terms of the PPE and staffing, we have PPE available for long-term care facilities if they start to run low. That is available through the city, and we are working with all long-term care facilities to ensure that they have access to the PPE. We also, if a long-term care facility does not have sufficient staffing for some reason, then we work with our local nurses and doctors and others to be able to help support that, as well as regional, and sometimes, if needed, the state will help support long-term care facilities to ensure they have the appropriate staffing.
All right. Are you looking for volunteer contact tracers?
We are not looking for volunteer contact tracers at this time. We have a large team that has been trained up in the city, and they are doing the investigations, contact tracing, as well as the new technology that we've implemented. We feel like we are in pretty good shape at this time.
Okay, thank you, Kelly. Now we're going to have some questions from the media. First question comes from Veronica at ABC. Go ahead, Veronica.
Hi, thank you so much for taking the question. This is for the mayor. On behalf of everybody at KABC, we just want to say how sorry we are to hear that your mother and stepfather have been affected by COVID-19, especially as you try to lead your city through this pandemic. I know you talked a little bit about it at the beginning of this press conference, but are you able to, or willing to share more about what they're going through and how they may have contracted the virus?
Honestly, we're not sure how they exactly got the virus. Like I said, they are very careful people, especially my mom, because of the line of work she's in. As far as what they're going through is very typical to what any other patient in the hospital that is hospitalized with COVID is going through. Obviously, they were in the hospital first. Particularly, my mother was not on a ventilator at first, and then had to get on one. And then my stepfather, similar situation, and so they are stable. But of course, we're optimistic that they're both going to fully recover. But it is a process, and they're going to need to fight the disease. And then, of course, once that is over, they're going to need to recover. And the recovery varies for different people, and it's difficult for different people. Fortunately, their vitals are good. But we have complete trust and faith in the doctors and the nurses that are doing the work. And of course, we're praying and hoping, putting a lot of good energy on them. And I do want to think I've received just really kind notes and words of encouragement and prayer from so many individuals and different congregations. And so I really appreciate that. And thank you for your care too.
Thank you, Mayor. Next question comes from Valerie at the Long Beach Post. Go ahead, Valerie.
Hey there, can you hear me?
Yes.
Okay. We heard today from the JIC that Long Beach's 7-day average positivity rate is 15%. How does that compare historically to our highest positivity rate, and how does that compare with LA County? And are you guys, worried about that jump in positivity rate?
I'm going to let Kelly comment on that.
So our highest rate was 15.2%, which was a couple days ago. It's 15.1% today. That is the highest that we have had since we entered into the pandemic. Our lowest, when we started opening, before we started opening things, was 6.3%. So we are much higher, and we are concerned that that is something that we're paying a lot of attention to, and one of the reasons why we're advocating so hard for people to make sure that they're taking care of themselves and their community.
Thank you, Kelly. Next question comes from Haley at the Press Telegram. Go ahead, Haley.
Hi, this question is also for Kelly. With the increase in hospitalizations that we've seen over the past week, can you explain why the bed usage at local hospitals would be remaining stable?
So the data that we get around the bed utilization is hospital reporting to the state, and as the mayor indicated, sometimes that can have a little bit of a lag on it. So we continue to track that every day. It is up a little bit. We had our hospitalization numbers were in the lower, in the sort of mid-50s for a while. It's now around 60% overall. And we did see an uptick for a little bit in the ICU beds, but that is stabilized.
Thank you, Kelly. That's it for questions. Now we will have the mayor come back up to say a few more words.
I'm just going to also, certainly I want to just reemphasize also, Long Beach Unified School District, for all the parents and families out there, made an announcement today that they will be starting the semester all virtual. And so I know most parents have already heard, but I want to make sure the community is also aware that beginning in the school year, classes will be all online. I know there was a discussion earlier that there might be a mix or some in-person. That has changed and been adjusted. And the superintendent and their leadership team I spoke with today are ready to really implement a really robust online and virtual experience for families and of course for kids and for teachers as well. I just want to share in talking to our team that we support the school district. This is the third largest school system in California. We fully support the incoming superintendent, Dr. Baker, and our teachers that are working really hard inside the classroom and doing the work. And so we are committed to helping the school district in any way as they transition to this time. There probably is no bigger question for us than how we get our kids safely back into the classroom, and that's something that we are working on with all of our partners and are completely committed to. And so right now it's going to be all online, and then they'll make some decisions in that semester about how much longer that will last, or if there's a transition to other types of teaching. So just wanted to note that as well. And if there's any other questions, Kevin, we can take those. Nope? Perfect. We'll do our Spanish translation then.
Muy buenas tardes. Hoy es nuestra sesión informativa del 14 de julio. Gracias por acompañarnos hoy. A partir de hoy tenemos 5,849 residentes que han salido positivo por el coronavirus, que es un aumento de 228 desde el sábado. Aproximadamente 4,229 personas se han recuperado del virus y hemos perdido a 151 residentes de la ciudad de Long Beach. 116 de esas muertes se han asociado con centros de enfermería de largo plazo. Quiero empezar con una nota personal del alcalde. Durante el fin de semana, su madre y su padrastro salieron positivos del coronavirus y actualmente están los dos hospitalizados y con ventiladores. Afortunadamente, ambos están en condiciones estables y se espera que se recuperen por completo, y apreciamos mucho la heroica atención que están recibiendo este momento en el hospital. Comparto esta noticia como una promesa para ustedes de que como un hijo y como su alcalde continuaré guiándonos a través de esta pandemia con resolución. También el alcalde y su pareja han tenido mucho distanciamiento físico con su mamá y con su padrastro. No lo han visto en varios meses ya, entonces, y también ambos se han hecho la prueba y los dos salieron negativos. La ciudad de Long Beach, desde el que empezamos a reabrir los negocios y la ciudad y la economía, nos movimos muy despacio en este procedimiento para asegurarnos que hiciéramos todas estas reaberturas primeramente saludablemente y para proteger a nuestra comunidad. Pero desde ayer el gobernador Newsom anunció varios cerraduras obligatorios en el estado que afectarán a muchos de nuestros negocios aquí en Long Beach de nuevo. El gobernador Newsom ordenó el cierre estatal de muchos sectores que ya han cerrado desde hoy en nuestra ciudad. Los lugares, por ejemplo, restaurantes o cualquier lugares de gimnasio y ejercicio cerrados, también hasta los restaurantes, áreas cerrados. Si es que su negocio puede funcionar en aire libre o afuera, sí es posible todavía mantener su negocio abierto. También muy importante que los lugares de culto, iglesias y religión pueden continuar brindando servicios al aire libre siempre que existan protocolos de seguridad adecuados. En anilación con los cierres estatales, nuestro Departamento de Salud emitió una orden de salud recientemente enmendada para reflejar estos mandatos vigentes hoy y hasta un nuevo aviso. Para obtener más información, visite nuestro sitio de COVID-19 en nuestro website, que es longbeach.gov/COVID-19. Las empresas con preguntas también pueden llamar a la línea de información al 562-570-4BIZ. Entendemos que este revés afectará a muchos de nuestros negocios en la ciudad. Sin embargo, debemos continuar siguiendo los datos y las pautas emitidas por nuestro gobernador y expertos de salud estatales y locales para frenar la propagación del coronavirus. La protección de salud pública ha sido y siempre será nuestra máxima prioridad. Seguimos con algunas actualizaciones de datos de salud. Hace un par de semanas, que fue el 29 de junio, compartimos unos análisis de varios datos relacionados con el coronavirus y ahora nos gustaría proporcionar una actualización donde estamos desde hoy. La primera imagen que enseñamos fue casos por fecha del episodio. La primera imagen indicó los casos del coronavirus por fecha de episodio. Hace una semana estábamos a solamente 4,690 casos y como les acabamos de decir ya, desde el sábado hemos pasado las 5,000, que ha sido un aumento de 25% más de 1,000 casos. Entonces, en solamente una semana. Creemos que este aumento puede atribuirse a varios factores que incluyen que hasta la fecha hemos realizado casi 94,000 pruebas en nuestra ciudad. Debido a un retraso en la presentación de informes, anticipamos que los números reflejados en la área sombreada del gráfico aumentarán a medida que entre los resultados de las pruebas pendientes. En la imagen número 2, que son casos por población, Long Beach está representada por la línea azul clara. Seguimos por encima de la tasa estatal, pero casos por cada 100,000 personas. Continuamos con la tendencia y a continuación en casos por 100,000 en comparación con la ciudad de Los Ángeles y el condado. La imagen número 3 es nuestros datos sobre las muertes por cada 100,000 personas. Long Beach está representada y nuestras muertes del coronavirus por 100,000 personas está debajo de la tasa del condado de Los Ángeles y por encima del nivel estatal. Hemos visto un aumento en los casos de los últimos días. Nuestra tasa de mortalidad sigue siendo constante. Dicho esto, sentimos el impacto de cada muerte, lamentamos la pérdida de 151 personas y extendemos nuestros pensamientos y nuestras oraciones a todas esas familias. En la imagen número 4 son las hospitalizaciones a largo tiempo. La imagen nos enseñó que la tasa de hospital se mantiene estable y un promedio de 101.6 durante los últimos 14 días y al 91.2 en los últimos 28 días. Actualmente casi 40 de nuestras hospitalizaciones están asociadas con residentes de centros de atención y enfermería de largo plazo que tienden de tener temporadas más largas cuando una persona en esos lugares se enferma. Y claro que están monitoreando muy cercanamente. La imagen número 5, que son los datos de los hospitales de nuestra ciudad. Nuestra capacidad hospitalaria continúa siendo estable y adecuada. Tenemos un total de casi 1,500 camas de hospital en toda la ciudad, una capacidad de aumento de más de 541. Nuestro uso de la cantidad de ventiladores continúan siendo saludables. Además, tenemos cerca de 1.5 millones de unidades de equipo de protección personal e inventario para todo nuestro equipo médico y todos los que están haciendo servicios médicos en la ciudad. Nuestra directora, Kelly Colopy, que estuvo también hoy con nosotros, nos brindó algunas estadísticas sobre el criterio de estabilidad de la ciudad. Como saben, hemos hablado de estos 6 criterios. La lista tiene 6 cosas y nosotros no estamos cumpliendo en 2 indicadores. El Estado solicita que la tasa de positividad esté menos del 8% durante 7 días. Nuestra tasa de positividad desde hoy es el 15.1% y subió 6.3% desde que comenzamos esta pandemia. Actualmente estamos en 320 casos por cada 100,000 personas, que es 3 veces más el número que debemos estar. Aproximadamente el 40% de nuestras camas de las unidades críticas se están utilizando actualmente, y eso puede cambiar mientras vemos más casos positivos, y entre más severa sea la enfermedad en las personas, más se necesitan estas unidades críticas en los hospitales. Desde la última vez que compartimos datos con usted, más personas menores de 30 años de edad continúan saliendo positivos. 1/3 de nuestros casos son ahora de menores de 30 años, en comparación con menos del 15% al principio de la pandemia. De hecho, el 21.5% de los casos menores de 30 años pertenecen al grupo de edad específico de los que tienen de 20 a 29 años. Este grupo de edad tiene el mayor porcentaje de todos los grupos de edad en la ciudad. Estamos viendo un aumento en aquellas personas de edades de 40 y 59 años también. Estamos también viendo que las personas jóvenes que están de 40 a 59 han sido hospitalizadas también, que ha sido un gran cambio. Es muy importante que tengan mucho cuidado, no importa si está saludable o está joven. La gente no está protegiéndose, obviamente hay más personas que están saliendo por afuera, es gente que está regresando a trabajar, y también han visto muchos reportajes y llamadas que la gente que no son del mismo hogar se están conjugando juntas, por ejemplo, familiares cercanos, amistades, vecinos, en grupos, y no se tienen que confiar, se tienen que nomás estar en grupos familiares que viven en el mismo hogar. Queremos brindarles la información más adecuada y los cambios que estamos viendo ahorita en nuestros sitios de prueba. La última semana desde el 5 de julio al 11 de julio administramos más de 12,300 pruebas. No podemos agradecer suficientemente a todos nuestros voluntarios en nuestros sitios de prueba y al personal médico que han estado apoyando estos sitios 7 días a la semana. Queremos asegurarnos que sepan nuestros sitios de prueba administradores por la ciudad tendrán nuevos horarios a partir de mañana, miércoles 15 de julio. El colegio de Long Beach City College sobre la Pacific Coast Highway será de lunes a viernes de 10 a 1. El estadio de veteranos del colegio de Long Beach será de lunes a viernes de 10 a 1 por la mañana, y luego cerrarán por 2 horas y pocas horas, y luego reabrirán los mismos lunes a viernes, pero de 3 a 5 de la tarde. Y Cabrillo High School será el único sitio que estará abierto en los fines de semana, y tendrá 2 horarios en ambos días, sábado y domingo, de 10 de la mañana a 1 de la tarde y de 3 a 5 de la tarde. Otra vez, solamente este sitio es el único que va a tener más de 1,200 pruebas cada día en los fines de semana, empezando este fin de semana. Debido a la mayor demanda de pruebas, se requieren citas para todos los sitios de pruebas, y que puedan hacer una cita llamando al 562-570-4636. Además, también las pruebas solo vamos a ofrecerlas a los residentes que viven en Long Beach, en las ciudades cercanas como Signal Hill, Lakewood, Paramount y Compton. Los residentes externos serán redirigidos y referidos a las instalaciones del condado. Los horarios de citas estarán disponibles no con más de 3 días de anticipación. Las citas sin cita previa no estarán disponibles en ningún sitio de prueba, con excepción de nuestra clínica de evaluación rápida. Primero, en mente le van a evaluar un equipo médico y referir para una cita ese mismo día. Pero eso solamente es a pie, no es vía drive-thru o por su automóvil. Eso estará abierto cada día, solo de lunes a viernes, de 10 a 1 de la tarde, en el colegio de Long Beach City sobre la PCH. Unos recordatorios sobre datos sobre nuestro distrito escolar de Long Beach. Sabemos que el condado de Los Ángeles anunció los cambios de ellos, y por lo tanto nosotros también vamos a seguir esas pautas, y el distrito decidió desde el 1 de septiembre todas las clases para los estudiantes va a ser en línea. Desafortunadamente ahorita, por los números que se han lanzado del coronavirus, no podemos darle opciones a los padres si es que quieren que los niños se queden en casa o que tengan sus clases en persona. Desde septiembre 1, a partir como hasta el 5 de octubre, va a ser todo, las clases serán en línea como terminaron su último año escolar y ya después de eso, cuando tengamos más anuncios, les sabremos saber. Por favor, recuerden que es muy importante quedarse en su casa, seguir usando sus coberturas faciales cuando salga afuera, a las cosas solamente necesarias. Esa es toda la información que tenemos para ustedes hoy. Muchas gracias por acompañarnos. Desde hoy nos moveremos a tener estas sesiones de información empezando el próximo lunes y el próximo jueves también. That's all we have for you guys today. Thank you for joining us, and we will see you next week.